From the PESU National Program Office, welcome to Pediatric Environmental Health Radio, a podcast that highlights stories from leading experts in pediatric environmental health across the U.S. The PESU National Program Office supports a network of 10 regional PESUs across the nation, whose vision is to create healthy environments for all children. For more information, go to pesu.net. I'm your host, Whitney Sturton Hall. Well, today I'm talking to PESU expert Dr. Gina Solmon about the health effects of wildfires on children's health. So let's start with an introduction. Dr. Solmon, what is your role with PESU and when did you first get involved with PESU?
Oh, Whitney, I hate to date myself, but I've been working on pediatric environmental health for 30 years, and I was the original co-director of the Western States PESU back 20 years ago. And then I've done a number of other things in the interim, and I'm now back working with the PESU again and loving it.
Oh, well, I think it's so great that you have this history from, years prior and now you're back. I mean, it's got to be such an interesting perspective that you have. But before we get into talking more about the health effects of wildfires on children, what sparked your initial interest in environmental health in pediatrics?
Well, in some ways it's an easy one. I love kids and they're more vulnerable. They're susceptible to a lot of agents in their environment. They get more exposed than adults because of their smaller body weight, because of some of their behaviors, running around, crawling, sometimes putting their hands in their mouths, depending on the age. All of those things make them more vulnerable to all kinds of hazards in the environment. And then, of course, they have many years of life ahead of us, we hope, at least they do. And so if they're exposed to something now, we do have to worry about what that may do to them in the future. And so all of those things make me very interested in trying to protect kids and do whatever it takes to make sure they're safe.
So shifting now to wildfires, on a personal note, I actually wanted to share that I spent my childhood in Altadena, in an area that was destroyed by the Eaton fire.
Hard to watch it now.
It's so hard, yeah, so surreal and so heartbreaking. And I have, family who also evacuated in the Palisades fire, and luckily they were okay. But I just wanted to say I'm so glad you're here to share your expertise for people affected by all these fires going on in the Los Angeles area. Because it is so personal for so many of us. But what are some of the top health concerns you have for children who live locally to these wildfires going on?
My concerns vary a bit depending on where the kids live. If they're in an area where their home might either have burned or been now be surrounded by other homes that burned, or if they're a little further afield, but still in the LA area. The hazards differ, but in many cases there's overlap. So there's the air quality hazard, of course, that we're all thinking about. There's also concerns about the ash left behind in the areas that burned, but ash has been raining down in a lot of neighborhoods in LA as well. And then in terms of ripple effects and long-term effects, I really do think about mental health. Kids are hit hard by this. At least some kids are. It's very distressing. They sense how upset the adults around them are. They feel their schedules and routines are disrupted. Sometimes their outdoor activities are severely disrupted. Their sports, other things. Many schools have been disrupted. So this is tough, especially for kids who've just recently lived through the pandemic. So it's a time to really try to nurture our kids' mental health and make sure that they can get through this with as little scarring as possible, even though it's tough. We're all getting scarred by this.
Definitely. Yeah, I'm so glad you brought up mental health because it's such a big factor in all of this. What symptoms in children should caregivers be aware of that would warrant seeking medical attention from these wildfire effects?
I think that the main thing to think about is if your child has asthma or any other respiratory condition, watch them closely because that is definitely something that can be worsened from inhaling smoke. And the smoke has been moving around a lot. In some ways, the Santa Ana winds, although they've been horrible, have also moved some of the smoke offshore, which has helped us in a way, a weird way. So the air quality is sometimes terrible and sometimes not so bad. And so keep an eye on the air quality, but if your child is having breathing issues, get them in, get them checked out, and that is a key issue to stay on top of. Another thing is skin rashes and skin problems tend to flare up from smoke exposure. That was a surprise to me. Just a couple of years ago, a group of my colleagues from Stanford did a little study. It's a UCSF Stanford team, and found that during smoke events in kids, skin rashes spike up, dermatitis. And that's not surprising when you think about it, because our skin is in contact with the air around us. And so these inflammatory chemicals in the smoke can cause skin inflammation too. The other thing, as I mentioned before, is mental health. So if you see concerning signs in your child, they're withdrawn or they're having tantrums, that a change in their behavior could be related to trauma from the smoke and the fires. So again, seek help if you need it to help with those issues.
Okay, thank you. Yeah, I had no idea about skin issues. That's great to know.
A colleague of mine, he was actually a medical student when he started this work, and was like, I'm wondering if dermatitis is related to smoke. And I was like, interesting, And so I was a little skeptical that it would pop up as a real link, and in fact it did. So we'll see. I'm sure there'll be more research in that area.
Okay. Well, let's talk about air quality. I know you touched on this just now a little bit. But what are some steps families can take to keep their children safe when the air quality is poor due to wildfire smoke? And then I know you mentioned asthma and other respiratory conditions, thinking about those with this as well.
Oh my gosh, yeah, the air quality has been a source of a lot of concern, controversy. I got a lot of questions recently because the air quality actually was pretty good in most of the LA area, and people were kind of skeptical. They weren't sure whether to trust the monitors or not. I do put a lot of faith in the monitoring network in LA. There's a ton of monitors out there. I usually use airnow.gov as a good source, a place to go where you can either look overall at the air quality, or you can click on the fire specific air quality, and it will show you the fires, locations, and the air quality around them. But there's a ton of other sites that also have air quality information. And so keep checking those, or download the app, the Air Now app or the Smoke Spotter app onto your phone, and keep checking it, because the problem with smoke is it moves around. The wind blows one way, then it moves and blows the other way. You could be upwind from the fire and the air quality could be great, and then the wind turns around, suddenly you're in the smoke plume. So that's something to be aware of. During the times when the smoke is blowing away from you, it's okay. Let the kids out. They need that outdoor time, and so enjoy those little respites when you can. But when the wind direction changes and the air quality starts to look bad, that's to have the kids inside. It's generally safer indoors. If you have an HVAC system, then use that. If you check your filter on your HVAC, that might be a good idea. and on the side of the filter, it should say MERV something, and there will be a number. And that number, the higher the number, the better. You want it, a MERV 16 is the best you can get. MERV 13 is pretty darn good. Anything less than that is not going to be fully protecting you. Also, if you've got an outside air intake on your HVAC, shut it during the times when the smoke is bad. Open it up when the wind's blowing in a favorable direction. But that's another thing you can do. In addition, if you can bring your car to the shop, or if you're a handy person, you can fix it yourself, is change the cabin air filter in your car to make sure that it's fresh. Or even better yet, just put the car ventilation on recirc so that it's not pulling in outdoor air into the car when you're driving around with your kids. And then air cleaners, sometimes called air purifiers, those can help a lot. And the main thing to look for there is the 4 letters HEPA, H-E-P-A. HEPA air cleaners mean that they're high efficiency. They will filter all the particles out of the air, or most of them. And one of the key things about those particles is a lot of the other toxic contaminants from the fire sort of glom on. They absorb onto the surface of the particles. And so if you can get the particles out of the air, you're doing 90% of the work to keep your air clean. So HEPA air cleaner is great. Make sure that it is designed for a big enough room. So you have to measure out or estimate the square footage of the room where you're going to use it, and get one that's big enough so that it can really keep up with the amount of air that fills that space. And having one in your child's bedroom is a great thing. Just have it run overnight. It's nice white noise, sometimes helps with sleep, and it certainly keeps the air cleaner in there. I tend to avoid the air cleaners that advertise ion technologies or plasma wave or this or that. Good old-fashioned HEPA is really, really tried and true. It's proven effective. All these other technologies can create weird chemical reactions with other things in the air, including with some of the chemicals in the smoke, and they can sometimes make things a bit worse. So go for HEPA. If, however, the filter also has a carbon layer, that's a bonus. The carbon layer looks black when you look at the filter, and it will capture chemicals that are called volatile organic compounds, or VOCs. So that was a lot to digest all at once, and I haven't even talked about respirator masks yet. The thing about respirator masks, though, Whitney, is that they're not so great for kids because they're not designed for little faces. And so that's why I emphasized giving those kids a clean environment in the home or in their school, because I don't feel like you can rely on the masks. They often, kids just end up breathing air that leaks in around the edges of the mask because their face is small.
Okay, that's really good to know. Thank you for all those wonderful tips. I forgot completely about changing car filters, and that brought me back to memories of doing that years ago after a fire. So that was so helpful. What about water quality? I know this is something you have worked on, unrelated to PACU. I was reading about your work after the Paradise fire. But so recently, NBC News had a story about the LA Department of Water and Power, and then the Pasadena Water and Power Department sharing information with residents about water not being safe to drink in certain areas, even if boiled. So boiled water should be used. Why is water quality a concern, and what steps can families take? How do they know when it's safe again?
Yeah, the water quality. Those advisories were a great move on the part of the water companies, It's precautionary wise because we have had problem after problem with water quality in burn zones in California and even outside of California. But this is a weird thing. It shows that we're always learning new things and getting sort of sometimes nasty surprises. And drinking water contamination is a nasty surprise that I encountered for the first time a few years ago. It actually first happened in 2017 in Santa Rosa after the Tubbs fire, but only 13 homes survived in the Fountain Grove neighborhood up there, and so it wasn't a lot of homes that were affected. But then it happened again in 2018 after the Camp Fire in Paradise, California, and that's when I jumped in and got involved. So what happened, and I'm sorry to say, I think it's likely this happened again in LA. We're going to see what the data show, but probably happen again, is that smoke from all of the burning materials, the plastics, all the nasty stuff, the car tires, everything that was burning up, all that smoke got sucked in to the drinking water pipes. And the reason that happened, and we saw this on the news, was the firefighters ran out of water. Remember that on the first day of the fire? And some of the parts of the water system ran dry. And when that happens, it turns into a big suction pump, starts pulling in smoke. And then the smoke goes inside the water system where only water should be. And it sticks to the inside of the pipes. In part because there's a biofilm on the inside of the pipes, and it just absorbs a lot of these chemicals from the smoke. And it doesn't release those chemicals quickly. So after the campfire, we found areas that were contaminated as long as 6 months after the fire, which is a really, really long haul. Now, that said, the good news is that areas outside the immediate burn zone should be fine. The drinking water should be fine. The areas where the water pressure did not drop during the fire, the smoke never had a chance to get into those parts of the system. They were pressurized with water. That water is okay. But if you happen to be returning to a home that survived the fire and it's surrounded by other homes that did not, you should not be in contact with that water because that water is presumed contaminated until proven safe. They're going to be coming around, they're going to be testing the water, they're going to be literally having to go house by house to clear and make sure everything's okay. But until they do that, presume you're going to be using bottled water for everything, toothbrushing, making soup, making coffee or tea, and certainly for infant formula, if you're mixing that up with water, or just for drinking. So that's the situation, and it is something that is. As soon as I heard that the water system lost pressure, and that some of the hydrants and pipes went dry, I thought, oh no, we're in for it again with the drinking water in those areas.
Thank you. Yeah. What about things like showering or just even washing your hands? Is that something that is a concern or not because you're not ingesting the water?
Sorry to say, some of these contaminants can be absorbed through the skin. So especially for kids, I'd advise not showering in the water. Hand washing, I think you could get away with that. The hands have pretty tough skin on them, and not that much gets through, just hand washing. And hand washing is so important, but do it in cold water, and maybe don't spend as long as you might otherwise washing under the water. The thing here, the chemicals we're talking about here are so-called VOCs, or volatile organic compounds. And they are a whole mix of different things, but the one we're most concerned about is benzene, which is really it's a component of gasoline, but it also is a component of fresh wildfire smoke right close to the burning homes. And so that is something that they're going to be testing for in the water.
I was wondering if you want to mention anything about soil quality or ash in the soil.
No, definitely. I'm happy to talk about ash and soil quality. I've been getting a ton of questions about the ash, and I do think those are important questions. And complicated because it really depends a lot on how much ash fell and where it fell. But there are contaminants in the ash. A lot of things called polycyclic aromatic hydrocarbons, often known as PAHs, and often heavy metals, even including things like lead. So we do want to be careful about the ash. I've heard anecdotal reports of people using leaf blowers to kind of blow the ash off their property. That is one bad idea, a terrible idea. Don't blow that ash up into the air. Keep it on the ground. In fact, sprinkle a little water over it, even if it's contaminated water, because the ash itself is contaminated anyway. So keep that ash wetted down. Keep it on the ground. Don't disturb it and blow it up in the air. But you can gently sweep it up, or if it's in any sort of indoor spaces, you can use a vacuum cleaner with a HEPA filter. Same kind of high efficiency filter that you want for your HVAC system or your air purifier. So use those kinds of things to clean up ash indoors. Gently sweep ash outdoors, but kids should not be anywhere around when you're doing that. The other thing you can do in a lawn is really wet it down and sort of drive the ash deeper under into the thatch of the grass. But again, you kind of want to keep kids, especially if they're little ones, away from any situation where they're going to come in contact with the ash. If you've got a toddler who likes to crawl around or who likes to put toys or their hands in their mouths, do not get them anywhere near the ash if you can avoid it. If it's an older kid, then it might be a different story. But those toddlers, if it's on the ground, it can end up inside their mouths. If it ends up inside their mouths, they can swallow it, and that is something we really want to avoid.
Okay, thank you so much. Okay, thank you. Well, for healthcare providers who may be listening, what's one piece of advice about the health effects of wildfire on children that you'd like to share with them? I guess a way to think of it is just kind of like the top thing that comes to mind that you would want to advise other peers.
Yeah, for healthcare providers, I've been talking a lot with folks in LA and answering questions, physicians, pediatricians, and a lot of them are asking some of the same questions because their patients are asking them a lot of these questions. But, from the perspective of treating wildfire smoke inhalation injuries, it's the same principles as treating any other like asthma exacerbation or other respiratory exacerbation. I do want to flag for healthcare providers that we are at the peak, as everyone well knows, we're at the peak of our respiratory virus season right now. So there's a lot of flu going around. There's still a lot of RSV. There's a fair amount of COVID and a whole bunch of colds. And smoke inhalation has been shown in multiple studies to worsen viral infections. So you may see kids who otherwise might have done fine with some respiratory illness, and now they're a lot sicker than they would otherwise be. So that's something to just be a little cautious about because, the smoke sets people up for worse infections. And so I think those are the main pieces of advice. A lot of physicians are very much attuned to the mental health impacts of what's going on right now in LA. And I'm really glad to see a lot of attention and willingness to talk about the stress, the trauma, and the ways that affects kids' health.
Yeah, that's a great transition to the next question because it seems like, understandably, there's so much anxiety coming from parents too, and caregivers about their children, and when can they play outside, and can they take their mask off, and
these resources and others are posted in the show notes
so what's
of this
one
episode.
piece of advice about the health effects of wildfire on children that you'd like to share with them? Thank you to our guest, Dr. Gina Solmon, and all of you for tuning in to Pediatric Environmental Health Radio. This podcast is a project of the PACU National Program Office, supported by the U.S. Centers for Disease Control and Prevention's Agency for Toxic Substances and Disease Registry and the U.S. Environmental Protection Agency. The Public Health Institute serves as the National Program Office with advisory support from the Association of Occupational and Environmental Clinics. The findings and conclusions in this presentation have not been formally disseminated by CDC, ATSDR, or EPA, and should not be construed to represent any agency determination or policy. Use of trade names that may be mentioned is for identification only and does not imply endorsement by CDC, ATSDR, or EPA. Please join us next time as we share more pediatric environmental health stories. To learn more about our program, find resources, and see how we are making meaningful contributions to pediatric environmental health, visit our website at pacu.net. This podcast is produced by Whitney Sturton Hall. Our graphic element was drawn by Robin Hall, and our theme music is by Roman Kano.